What's up, everybody, and welcome back to Not Just Adulting, where we are untangling the realities of adulthood because adulting is not always a straight line. I'm your host, Felicia D, and for those of you who are just joining us for the first time, a welcome. And for those of you who are returning, of course, welcome back. So today's topic, we are going to have a overdue conversation about the woman's body. Okay, so fellas, before you walk away and I'm not listening to this one, you should probably stick around because you may just walk away listening, or excuse me, you may just walk around just learning something new about the woman's body, and it might help you to understand just what she's going through, not even just once a month, but just throughout her whole womanhood. Okay, and so we're going to be debunking some myths here, and we're also going to have a nice little talk about what we should be discussing, not only with our OBGYN, but also with our moms, our grandmoms, and different people in our family, just to find out what they've experienced in their past, so maybe it can help us be proactive with our bodies and for our future. So before we go straight into introducing you to our guest today, I want to let you know now, subscribe, so that way you'll know when we have new episodes out, and even if we have some extra footage, some behind the scenes stuff, you just may never know. Also, you can still check out the merch that we do sell on www.notjustadulting.com. Okay, so check us out. All right, without no further ado, let me introduce you to our guest for today. All right, so now I'm going to introduce y'all to my guest for today, Dr. Kristina Williams. Dr. Kristina Williams is a passionate advocate for women's health, education, and equity in medicine. She is an assistant professor of obstetrics and gynecology at Cooper Medical School of Rowan University and practices at Cooper University Hospital in Camden, New Jersey. A South Jersey native, Dr. Williams earned her BS in chemistry from Spelman College, graduating summa cum laude before attending Harvard Medical School to earn her medical degree. With years of experience in general obstetrics and gynecology, she cares for women at all stages of life, whether for routine exams, pregnancy, or conditions like fibroids, PCOS, and menopause. Dr. Williams is deeply committed to educating and empowering women, particularly in minority communities, to take charge of their health. She frequently speaks on panels about diversity in medicine and enjoys mentoring future physicians. Through her work, she aims to break down misconceptions, improve patient-provider relationships, and promote better health outcomes for all women. Welcome, Dr. Kristina Williams.
Thank you so much.
No problem. Welcome. I'm so glad to have you here.
I'm happy to be here.
Your bio is so impressive.
Oh, thank you.
It's so impressive. I'm all stumbling over words. I'm like, oh my gosh. Because I'm just impressed. I'm like, okay, girl, I see you.
Oh, thank you.
That is so awesome. That is so awesome.
Yes,
So
it was definitely a long journey, but we made it.
I believe it. Like, what made you choose to want to even go into this field of study?
Yeah, I mean, I have always been good at math and science, but when I was in medical school, I was pre-med, and that was kind of the typical thing to do. But when I kind of was doing community service things out in the community, um, I just really felt a passion for helping people and talking to people and hearing people's stories. And I come from a family that I have, two younger sisters, my mom. Um, so lots of women, and I just felt like, what would be better than to be able to educate them on their own health. And so that's really why I chose OBGYN. I love the patient population. I love everything that I do, including delivering babies, surgery, seeing patients in the office. It's a good mixture of all different type of things. So yeah, it just fit me. It fit my personality.
That's perfect because we need a doctor who it fits their personality,
Mm-hmm.
because
Mm-hmm.
it's like your job is so important. It is so important. I'm gonna say thank you, and I'm not even your patient. But thank you. We need people who are passionate about,
Yeah.
the woman's body and how it works because it's ever changing, and
Mm-hmm.
everybody's body is different. So
Mm-hmm.
thank you
Mm-hmm.
for your passion for that. So I really wanted to talk about this, particularly in March for Women's Month, even though this might be aired in April, it's still for Women's Month. And I really wanted to talk about this because so often we're having conversations with other women about our bodies, but it's just like, it's not always going to be factual, you know? So I just wanted to hear from an actual doctor, like some of the different areas that we discuss in like everyday conversations that might not really be true, or maybe they
Mm-hmm.
are, and maybe you can like elaborate on some things for us.
Yeah,
But a lot of the women who also are listening to this show, we're starting to experience new things in our bodies as we are getting older, and
sure.
we don't even know anything about it. So I really wanted to just take the opportunity to honor the woman's body and to kind of debunk some things and get some
Mm-hmm.
clarifications. So I did want to actually ask you, like, what is one of the wildest myths that you've ever heard, like, come from a patient that stepped foot into your office?
Myths. There's a lot out there. I don't think that there's anything that's necessarily wild because I would say that, sometimes the body does work in mysterious ways. Like things are linked and you wouldn't even expect it. So when somebody believes something that isn't necessarily true, I can understand, where they're coming from. You know what I mean? And
Mm-hmm.
so I wouldn't say that I've ever really heard any wild myths. I will say that, there's a lot of social media education that's going on right now. And it's some of it is actually good, but some of it is not. And I think it's very difficult for patients to or women just to sift through and know what's true and what's not true. And the unfortunate part too is that like not all physicians are created equally. And so while we all go through the same type of training, physicians hold different beliefs as well. And, it's hard to sometimes trust your physician because, there's a history out there in
Yep.
this world of,
Mm-hmm.
doctors doing crazy things. So,
Yeah.
and telling lies and things like that. So, that's very unfortunate. What I will say is that, you know, I think a big myth these days, and I think this is kind of an unfortunate one, is that you can test your fertility. The reason I say that is because there are a bunch of companies out there that will market, oh, I can tell you what your fertility is. It's like $300, you get blood tests, all these things. But they really don't give you any actual information. And I think it's unfortunate because women are putting out all this money to get, all these tests done, but they don't really give you any factual information at the end of the day. And so, a lot of women come to me to say, hey, can you test me for my fertility? And I wish there was a test that was accurate for that. But there really just isn't a blood test per se that's accurate in me telling you, oh yeah, 5 years from now you'll definitely be able to have a baby, or 5 years from now you won't. There's just no test for that. It is something that you have to um, kind of play out. It has to play out on its own, to be honest. So um, yeah, that's the best I can think of at the
Yeah.
moment. That's kind of like a big topic of conversation. I hear that a lot.
I can only imagine. I feel like that's such a like a topic that most people, like when it comes to like fertility, that's like that's everybody
Hmm.
wants to know what that's going to
Yeah,
look like for them. They want to know if
right.
they can have children. And you know what's crazy is that I have, no, maybe it's not crazy to you, but like for me, I know that some things you just don't even find out about your body until you are ready to have children.
Hmm.
You know? And
Exactly.
so it would be beautiful to be able to have like just this test that tells you everything. Like, hey, you might struggle because you got fibroids. You
Hmm.
might, because most people don't even find out like that they have PCOS until they're
Hmm.
ready to have children or anything
Exactly.
else.
Hmm.
So I can imagine that that's definitely something like, look, we just got to go through the process.
You have to just go through it, and you just need somebody who's going to support you through it, right? So I think that's what is the most important thing, is that when you're ready, finding somebody that you connect with and somebody that can help you through that process, so that if you do have issues, there's somebody there that can kind of address those issues right away. So I think that's the most important thing.
Yeah. I think people need to start to, because I didn't even notice myself, or realize I should do it, but like kind of like start dating your doctors a little bit before you make
Mm-hmm.
that decision on who your doctor should be, you know?
Yeah.
Sometimes we're
Yeah.
just like, okay, this is our doctor, cool, and then just go for it. It's like, no, you
Right.
guys kind of got a match.
Exactly,
So,
exactly.
uh,
No, because I think that's so important because a lot of times, sometimes women don't see the first time they see an OBGYN is when they're pregnant. And at that time, it's like you're on a time clock, right? So you establish with this doctor and then, you have a couple visits, and you're like, oh no, this one's not for me. But now you're already kind of all deep into the process and it's hard to switch after that. And even if you do switch, you still may not find someone. So most OBGYNs who see patients for like routine GYN care are the OBGYNs that also deliver and take care of pregnant patients as well. So, yeah, no, dating your doctor, I love that because, I think it's so important to find somebody that you relate to and that can hear you and takes care of you.
yeah, I definitely realized like once I moved to California and eventually got pregnant out here, I was just like, I definitely should have been more proactive, in finding the perfect doctor for me. Especially because I'm, over here. Like when I was back at
Mm-hmm.
home, I had the best doctor.
Sure. Yeah.
Shout out to Dr. Jane. I'm not allowed to do that, right?
No.
But yeah, shout out to her. She was amazing. But here, I didn't even realize that that was so important. And yeah, it was definitely interesting.
Mm-hmm.
So I did want to ask you about a few things that I found online
Mm-hmm.
and
Mm-hmm.
through social media. And
Mm-hmm.
so we wanted to know, first question, was why do some women develop acne in their 30s if they've never had it in their teenage years?
That's a good question. So the short answer, and this might be an answer to a bunch of things today, but the short answer is we don't really know.
Okay.
But probably the theory is that what happens in your lifetime is that, when you start, and I always, this is how I explain it to patients, but like when you start your menstrual cycles, your hormones are kind of like this, right? And then once you reach like 2 to 3 years into your menstrual cycle, your hormones are kind of at like a steady state. And then over time, they kind of like dip down. But then when you go into perimenopause, your hormones start to go like this. So basically, like as you age, your hormones start to kind of like whack out a little bit more again. And that happens at a different time period for everyone. So I have some women who it never happens, like they never kind of go through that stage again. But then I have some women who experience it like in their 30s, some women who don't experience it to their late 40s. Like everyone's different, and we don't know why one person's different from the other. But that hormonal acne probably happens just because of that kind of like change in hormones that we can't necessarily measure because your hormones are in the morning different from they are when what they are at nighttime, different from what they are the next day. And so if I measure at one point in time, that really doesn't give me any information. And there's not really any tests that measure them over time that can really give us any information either. So it's kind of like a crapshoot, honestly. It's like we don't really understand them totally well.
Mm-hmm.
But yeah, it probably has something to do with just kind of like not necessarily having like an abnormal hormonal level, but kind of like the way they work together and how they're kind of like all over the place.
Yeah, that's $1 million question right there.
Yeah, it is a
How do
million
the
dollar
hormones
question.
work?
Right. Oh my goodness. It is.
Because they are literally all over the place, all over the
Yeah.
place.
Yeah.
Okay, so should you use soap to wash your vaginal area or is water enough?
So the textbook will tell you that water is enough. I
Okay,
use soap. Okay.
okay.
But I don't go inside or anything like that. I don't douche. I don't do anything like that. But I treat the skin on the outside of my vagina the same way that I would treat the skin on my face, actually, because it's like a sensitive area. So I
Mhm,
use like a mild soap. I try not to like necessarily, I do use a washcloth, but I try not to like really scrub it or anything like that because then you can cause irritation to the skin.
mhm,
And so I use like I just use Dove soap, something non-scented. You do not need Vagisil or anything pH balancing or anything like that.
mhm.
I don't want to get anybody in trouble, but I don't love the Vagisil products because I think that
Okay.
they market to like something that's not, accurate.
Mhm.
But yeah, just like a mild soap, that's it. Yeah. Or
Okay.
you could just use water as well, but
But some soap
I
is
like I
not
like
gonna
soap.
hurt.
I don't know. I
Okay.
just grew up, I used soap and I never had an issue there. But I think as long as you're not like aggressive. Like I have some women who are like aggressively cleaning, but then that thins out the skin and causes irritation.
Mhm.
And then that's too much.
Okay. Because
Yeah.
especially like with the new brand Lumi and that
Hmm.
commercial, it's just like, okay, so what should we do? Because I know that I did hear from a friend before, because I've always used soap like my whole life. I probably did. I was probably doing too much. And like a scented, unscented, all over the place.
Yeah.
And then she was telling me, like, no, you're not supposed to. And so I went to my sister and I was just like, did you know we're not supposed to use soap when we wash it? And she was like, I told you that, like my aunt had told her years ago.
Yeah.
And I'm
Yeah.
like,
Yeah.
okay, so what are we actually supposed to do?
Right.
Because
Right.
okay, so you actually kind of answered the next question,
Hmm.
which was, is douching actually bad for vaginal health?
Douching is a big no.
Okay.
So basically what people douche for is to kind of clean out the inner vagina, but it's really a self-cleaning organ. There is bacteria there, and they're supposed to be, sorry, there's
Mhm.
bacteria in the vagina and there's supposed to be bacteria in the vagina, because that's kind of what keeps the vaginal pH low. And when you douche, you actually increase your vaginal pH, by kind of killing the bacteria that's supposed to be there. And that actually increases your risk of infections like bacterial vaginosis, yeast, things like that. So your vagina was made to kind of try to prevent those things.
Okay, so douching bad.
Bad.
Try to stay away from them. Okay,
Stay
no.
away from it.
Noted. Okay, and so this one is actually one that I definitely want to know the answer to as well. Does eating pineapple really change your taste or smell?
So that's a good question. And I don't think that there's any like actual data to support things, but I do think that the foods we eat come through our pores, they come through our system, they come through our organs. And so just like, if you eat asparagus, then your urine smells funny, right? So other foods can definitely have that effect on our other organs. So whether or not like pineapple specifically does something. I think some people may be a little more sensitive than others because it just kind of depends on how your body metabolizes different foods. I have some women who when they eat like a lot of fish, they actually notice more of like an odor, a vaginal odor. And I think that is a thing. But it's probably because they metabolize that fish a little bit differently than someone else. So not to say don't eat fish because, or anything like that, but I do think it's a thing to, sometimes the things that you eat can, come through your pores and things like that.
Okay, noted. So
Mhm.
before a nice night, probably stay away from the salmon.
Yeah.
Okay, and then here's another one. Why is peeing after sex important if urine comes from a totally different hole?
Yeah, that's a good question. Well, the hole is totally different, but it is very close to the vagina. And so it's really just like right on top of the vagina. And so what can happen is that because there's bacteria in the vagina, and intercourse kind of can create a path for that bacteria to come outside the vagina and even just kind of up to the urethra, which is where you pee from.
Mhm.
Um, that can seed that area. And so peeing after intercourse kind of helps to clear out that area so that, the bacteria doesn't kind of seed it and go up to the bladder.
I love that. The way that you
Yeah.
worded it, it's like, okay, that makes so much sense. Go pee.
Yeah.
Go pee.
Yeah.
Okay. And then the last one is, can sperm change your pH balance or is that a myth?
It can. It
Okay.
absolutely can. Sperm is basic, and the vagina is acidic. And so sperm in itself can like basically elevate the pH of the vagina. Thankfully, it's short-lived, so most women don't have an issue with that causing an infection. But it definitely can change the pH. It does actually change the pH for a short amount of time.
So, I wanted to talk a little bit more about things that people should ask you, or just things that you've noticed like that typically happens when people may come to you for an appointment. So, what do women typically hesitate to ask you when they're coming to visit for just like even a routine appointment?
I think that the biggest thing, the two biggest things, one is like any vaginal complaints, they kind of feel embarrassed about, if they have an odor or discharge or things like that. But then the second one is, intercourse. So a lot of times women are afraid to talk about like things like, "Oh, it hurts when I have intercourse," or, they have more dryness, or they have, things like a lower sex drive, things like that. Now, I will be honest, it's hard to talk about all of those complaints in one office visit. A lot of times if someone is having a lot of issues, I'll say, "Hey, let's schedule another appointment to specifically talk about those things." Um, but I don't like I am here for you, so I don't mind talking about those issues. I think one of the things too is that, you know, they've probably tried to talk about those issues before, and maybe someone has said like, "Hey, that's not like what we're here for today," or like they've kind of like not been listened to, things like that. And I'm a huge proponent, and I always tell women that, um if you feel like you're not being listened to, obviously find another doctor, but to schedule appointments, so like if there's something you feel really important about and something you really want to talk about, schedule an appointment just to talk about that. Because as a physician, if you come in just for your routine, that's on my mind. That's what I'm doing. I'm trying to hit all the points. Now I'm
Mm-hmm.
trying to do your pap smear. I'm trying to like make sure your breast cancer screen is good, all of that. And then, to talk about another issue, sometimes I don't have enough time for that. So I
Mm-hmm.
specifically will tell patients to come back for another appointment. But if that's what you want to talk about, I always say schedule an appointment specifically to talk about that thing so that
Mm-hmm.
you have the whole appointment time to talk about that specific issue.
That makes sense. That definitely
Yeah.
makes sense. I could see how, as a patient, I could see how bringing up some certain things can be a little uncomfortable. Like I know that one thing that I have always wondered is like, what is the like? 'Cause I know you had mentioned like about like smells or discharges. Like, what is a vagina supposed to smell like? Like I know that
Yeah. I
sounds
mean,
so adolescent. Like, mommy, what is this
yeah,
supposed to
no.
smell like? But
Yeah. Well, the vagina actually has like a little bit of a musk scent to it, which
okay,
is normal. And aside from that, it's not really supposed to have much of an odor in itself. Um, it's, like I said, it's a self-cleaning organ. It shouldn't smell fishy.
okay,
So that's not normal for it to smell fishy. Um, and it really shouldn't like it's not supposed to smell like roses or like anything like that. Like that's not real life. But at baseline, a lot of the vaginal fluids that come about have like a little bit of like a musk odor. And so, especially when a woman is stimulated, you may notice even more of like a little bit of a musk odor. And
okay.
that's totally normal. Yeah.
Okay, because I could definitely see how it's just like, okay, do you have any questions for me today? And it's just
Yeah.
like, dang, I know I got this smell, but I don't know if I'm, you know what I mean?
Like, I don't know if it's normal or not. Yeah,
Right.
yeah.
It
But
definitely.
because it's not much to just test for infections, right? Just to make sure to me, so if any vaginal complaints, discharge, odor, pain with intercourse, things like that, I'm always checking for infections just to make sure that there's not something underlying there that's causing that issue. And then once we confirm that there's no infections, then most likely what you're seeing or smelling or what have you, it's most likely normal or potentially due to something else, but it's most likely normal.
Okay, noted. Um, have you ever had to keep a straight face during an appointment?
I have. Yes. I have. There are some people, so one of the things, some people do not have any problems talking about sex and get really detailed and really graphic, and you're just kind of like, well, I didn't really need to know all that, but thank you for sharing. Um, so yes, I have had to keep a straight face before. Which my poker face is solid these days,
Yeah,
I'm just
that's
like
good. That's something you got to
yeah,
practice at home. Like,
it
okay,
is, it
so
is. Like just
if
don't
she says
react, don't
this,
react. Sometimes I feel like patients are trying to get me to react, to be honest, and I'll be like,
right,
I'm a little out right now, but yeah, no.
right, like
But
not
definitely
today,
some
not
people
today.
get like, and I try to use medical terms, so like vagina, penis, things like that, but people call the organs all different types of things. So but I try to keep it professional.
Right, right. I can only imagine, especially because you work in Camden too.
Yeah.
Girl. They be like, nah, we're gonna keep it a buck. It's called
Yeah, exactly.
this
Exactly.
is what happened. Okay. So what's the weirdest home remedy someone has tried for vaginal health?
I don't have anything weird. I mean, most people do like an apple cider vinegar. That's what like the most common like douche that I get. I'm trying to think, is there anything like that I was shocked by? I don't get shocked by a lot these days. So,
Okay, okay. I
um, yeah,
What
yeah. Is
about
it, but
like cranberry juice for like a was that
UTIs and
a U
things?
like a UTI or eating
Yeah.
yogurt for a yeast infection? Like
Yeah,
those
so
type
cranberry
things?
juice actually has showed some data to help to prevent UTIs. So drinking
Okay.
a lot of cranberry juice. Probiotics really haven't shown benefit for yeast infections, like yogurt and things like that.
Mhm.
The data is mixed, but overall it doesn't show like that it's beneficial. But I always say that it's probably like beneficial for your gut or for other things. So I always say like if you don't mind doing it, I think it's not going to hurt anything.
Mhm.
But like vaginal probiotic suppositories and things like that doesn't tend to seem to be useful
Mhm.
right now. So until somebody comes up with a formulation that is actually like data driven and useful, I don't necessarily suggest or recommend probiotics. So
Okay. That makes total sense. What about like when people are like thinking they may be pregnant and like different things that they might try to figure out to see if they're pregnant or not? Like, have you heard of any like weird stories with that? Like when people come to see you?
um nothing, no, nothing specifically weird. But I mean, I have had women who like just like could swear up and down that they're pregnant and they're
Mhm.
not. Like they're
Mhm.
like, it's like called phantom pregnancy when they're like, I feel something moving. And like they're like, but they're really not pregnant. Like we do blood tests and everything, and
Yeah.
they're not pregnant. But they're like, but I feel something moving on the inside. I'm nauseous all the time. My boobs hurt. Like I have all the symptoms. Like,
Mhm.
what's wrong with me then? And I'm like, I don't know, but there's no baby in
Yeah.
here. Yeah, so that's probably like the weirdest.
Right. That's definitely a thing, especially like when you're on your fertility journey. Like sometimes you just want to
Hmm.
be pregnant so bad,
Yeah.
and like it's just during that process you're just really trying to figure out um like you're just like because I think it's like we kind of like hyper focus on like what it might look like or what it might feel like to be pregnant that your body kind of
Hmm.
starts playing tricks on you because I know that's
Right.
how it was for me for sure like
Yeah.
when we were planning our first I was like watching all these YouTube videos and started going down the spiral trying to figure it out and I'm like every month I'm like yep it's happening
Right. Yeah.
and then that
Yeah. And
one
then
month I was like oh forget it and that was when it
and then
happened.
it happened. Yeah, that's the crazy thing too, is because, a lot of the symptoms that are pregnant symptoms are like also period symptoms.
Mhm.
So like you're like kind of like, "Oh, my breasts feel a little bit more tender this month. Good to be this month." You know what I mean? So yeah, yeah, yeah,
All the
definitely.
things. You're just like paying attention to every single detail.
Mhm.
And it's such a tiring experience. And then like I said, you that one month you're just like, you know what? I'm not gonna focus on any of this. I'm just gonna relax. And then boom. And then you don't even pay attention.
Mhm.
Okay. And can wait, I gotta ask this one first. Are Kegels really necessary or are they just another thing that women are told to do?
That's a great question, actually. Kegels, are they necessary? that's a thing to think about. Do they work? Yes, I do actually think that they help to strengthen the pelvic floor. And really we're looking towards things like, in the towards, time periods of menopause and things like that, or if you've had multiple kids or multiple children, birth them vaginally, things like that, sometimes that can weaken your pelvic floor. And the Kegel exercises definitely help to strengthen them. I don't think that Kegels, they haven't really been shown to reverse existing issues. But what we think is that they help to prevent issues from getting worse. But you really do have to do them, because most people will do, like, they'll think about it and, like, I'm sure like somebody listening right now is probably like, oh, let me do a couple Kegels right now, right? Because you're
Mm-hmm.
reminded. But really have to do them on a daily basis, probably twice a day, in order for them to be, useful. Yeah.
Okay, twice a day. Okay.
Yeah,
But
probably
like
like twice, 2 to 3 times a day. Yeah.
once in the morning, maybe
In the
like
yeah.
in the
I
evening.
usually tell people to do their Kegels right after they finish urinating, like using the bathroom.
Okay.
Because you're gonna use the bathroom at least probably twice a day, 2 to 3 times a day. And then
Mm-hmm.
while you're sitting on the toilet and you're like already kind of like using those muscles, so while you're sitting on the toilet, do like, 10 Kegels on the toilet.
Okay.
Squeeze, hold for about 2 seconds, release, do that 10 times. That's usually what I say.
Okay. Now what about like the Kegel balls? Like the different
Um,
equipment to
So the
speak
Kegel,
of.
so the equipments are mostly to help you to like identify the muscles, but
Okay.
if you already know how to do a Kegel, then the balls and things like that are probably not necessary.
Okay. Notice. So we could save money and just do it for free right there on the toilet.
Yeah.
I love it.
Yeah.
Yeah, I'm gonna like make sure I return those balls that I bought last week. Okay. And what's one major misconception that women have about their bodies? Like one of the like first ones that come to your mind.
Hmm.
That's a loaded question. Like
Yeah.
pretty hard.
A misconception about the body. So women, because we have all these hormones that change all the time on a daily basis, we go through a lot of stages. And like we go through puberty. That's a crazy time. Go through pregnancy. That's a crazy time. Postpartum. That's a crazy time. Perimenopause. Crazy time. Menopause. All of it, right? Um, and I think the misconception is that you're supposed to um just, like you're supposed to like bear through that and like not recognize and just kind of like be quiet about everything that's happening. Um and also a misconception is that like those changes aren't normal, if you know what I mean. Like, you know, I've never had children, so I have never experienced postpartum personally, but it's a hard time. And like
It is.
women, you go through it. Like, and it's not abnormal to go through it. You know what I
Mm-hmm.
mean? Like everyone goes through it. And when I say normal, I mean normal as in like this is kind of just what happens. And I think the common misconception is that women think that they're the only ones, or like they're only ones suffering through this time period. People just don't talk about it, I think.
Yeah. Yeah.
I think people don't talk about the changes that happen in menopause and perimenopause. Um, so yeah, in a nutshell, it's just that, we go through all these time periods, and like the misconception is that, you're supposed to always be happy or always be like
Mm-hmm.
without issues, you
Yeah.
know?
Yes,
Yeah.
exactly. That's exactly why I wanted to do this episode with you, because
Hmm.
I've noticed that lately, a lot of women that I've been around have been more open about
Hmm.
what's going on with their bodies. Like versus like, when you were little, like when we were little, like this has always stuck out to me, is that like we're kind of taught in a way to kind of like keep those um the female things that happen to us, to ourselves, and not share it,
Right.
and kind of like makes us like really not ashamed, but maybe I will use the word of shame. Like, for example,
Mhm.
like when you get your period, like you're so secretive about the way you wrap your
Mhm.
pad up. Like you're
Mhm.
using so much toilet paper in that
Yeah.
bathroom, sis, and you don't have to, you know? Like
Yeah,
that's why they give you the
exactly.
wrapper. Just wrap it up. But like we're
Right.
wrapping it up in toilet tissue, and like it's kind of like we're always kind of taught to keep those conversations like on the low or to a limit. But it's just like we will find out that so many different things are normal, or maybe they're not, by just having that conversation, but like we
Exactly.
just don't do it. I was talking to a friend the other day, and we were just having like it was like a group of us girls talking, and she was mentioning how she had a period earlier this month, and like 2 days ago she just got her period again. And so
Mhm.
she was like, is that normal? And we were all looking like, I don't know, girl. And then we were just trying to figure it out, and she was just like, I mean, I don't know either. And then we was like, should you go to
Right.
the doctor? She's like, should I go to the doctor?
Mhm.
you
Mhm.
know and so, but I was like grateful in that moment that we were having that conversation, because now I know that if I have my period 2 times a month, I need to be like, should I go to a doctor?
Mhm.
And be able to
Mhm.
have that conversation. But
Yeah.
a lot of times we're not talking about it.
Right. Because that's
You
the
know?
thing too, it's like a lot of times we don't know what's normal or abnormal because nobody talks about it.
Mhm.
And some things are normal, but some things aren't. And then you're just kind of like suffering in silence and you're not bringing it up because you think it's probably normal, but you're like, I'm
Mhm.
not really sure, if there's anything out there that can help me.
Yeah.
So yeah, no, yeah, absolutely.
I
Yeah.
think low key people are just still ashamed, like how we
Hmm.
used to be. And like, it's like, if I tell them this, then they're gonna think I'm nasty, or they're gonna be like,
Right.
ew, like, why you smell like, like we have to be able to be comfortable enough to say, hey, this is what's happening to my body.
Yeah.
And for people not to judge us in that moment. You know what I mean?
Like, to this very day, I don't know why I do, but even I do like, I could be in a room, I work on the labor floor, so it's
Uh
like a
huh.
room of all OBGYNs, and I'll still, like, take my tampon out of my bag secretly and, like, wrap it up and put it in and then,
Yes.
like, go to the it's like, "Girl, what are you doing?" Like, everybody knows, like, you're a woman, you get a period, like, it's
Exactly.
fine, like, you use
Why are
tampons,
we
like,
like
why
this?
do I do that?
I feel like that was like just taught to us when we were younger, and it's just like
Yeah,
just
yep,
something that you don't lose. It's like now that I live like where I'm paying the bills with my husband, and I see the price of this toilet paper going up, I'm like, "Ooh, I just put a whole wad in that toilet. I mean in that trash can. That did not
yep,
have to go there. I'm just going to wrap it
right.
up, maybe one swoop and throw it away." But I even remember when I my first time wearing a tampon, I was actually in high school, and nobody had any pads that day. And so
Mm.
I was like in the gym class, and I was just like, nobody has a pad or whatever. And so she was like, well, here, take this tampon and put it in. And I was like, I don't know how to do it. I've never worn one. And it was like, back in school, like they used to, like if they did have a pad, it was in a box. If they had a
Yeah, yep,
tampon, it was in a cardboard, thing.
yep,
And
yep,
so she was
yep.
like, you just put it in there and then pull it out. I didn't know what it was. So I just put it up there. And I'm walking around, and she's like, "How do you feel?" And I was like, I don't think I'm supposed to feel it, but I feel it." And she was like, "Well,
Yeah.
maybe you did it wrong." And I was like, "Well, I don't know. It doesn't seem to work, but I'm going home soon." So then fast forward to like years later, I had never worn a tampon again after that. We were going to the beach, and my cousin gave me a tampon, and I was like, "Girl, I don't know how to put it in. The last time I put it in, I think I did it wrong." So she went to the stall next to me and walked me through the process. And I was like, "So what am I supposed to pull out?" And she told me. And that's when I realized that the first time I put it in, I left the whole cardboard
Oh
up
my
there.
god.
It was just
Oh
chilling.
my
And I was
goodness,
like,
yeah.
"Oh my God." So I was like, "So that plastic thing is supposed to come out?" She was like, "Yes." So she's
Y
laughing, and I'm like, "I don't feel it." So,
yeah. But
but
how
I'm
would
like,
you know though? Like, how would
how
you
would you
know?
know if we don't
Yeah,
talk
like, how would
about
you
it?
know? Yeah. Yep.
My mom just taught me how to put a pad on, and
Mhm.
I never ever learned how to put a tampon on until I was at the beach.
Mhm.
So it was very interesting. So that leads me to, speaking of talking to our families and asking questions. This is probably the most important part of the episode,
Mhm.
because we are getting older, and our parents are getting older, and everybody's just going through all of these changes. But as I had mentioned earlier, sometimes you don't know things about your body until you're like, or things that may potentially happen until you're going through it. And that's when everybody's just like, oh yeah, that happened to me before. And you're like, wait,
Mhm.
why didn't you ever tell me?
Mhm.
Specifically like fibroids, PCOS,
Mhm.
endometriosis, what, menopause was for the people. So I wanted to kind of like talk about the kind of questions that we should talk to our relatives about,
Mhm.
like our mothers, our grandmothers, siblings, aunts. Like, what are
Yeah.
some of those questions that you think we should just go right
Yeah.
off back, maybe talking to them about?
Well, I mean, I think the number one is any history of any cancer. Like
Okay.
that's kind of like the biggest thing,
Mm-hmm.
because that's definitely like that could literally affect your lifespan. And a lot of times women when they come in and tell me their history, they're like, yeah, so and so had like some cancer. Like I don't really know. Was it their breast or ovary or cervix or like, and they're like, not, don't really have specific details. They're like, oh yeah, nobody's ever talked about that in my family. Or they'll come in, I've been seeing them for, years as a patient. They're like, yeah, I just found out like, over Christmas that like, my grandmother had ovarian cancer. Nobody ever told us. Like, it's just like somebody just mentioned it, over dinner one day, So I think, and that matters because especially gynecologic cancer, so that's your ovarian cancer, endometrial cancer, and then even your breast cancer, right? So, those three cancers definitely can be, we don't really have great screening for like ovarian cancer or even endometrial cancer. Breast cancer, obviously, is the mammograms and things like that. But it definitely helps to establish that history early on so that doctors know like what to look for or know what your risk is,
Mm-hmm.
and know like what to evaluate, if any of those like symptoms pop up. Especially for ovarian cancer, sometimes there's surgeries that you can get to like remove the fallopian tubes and ovaries early if like you have a strong family history, things like that, to reduce your risk of those types of cancers. Breast cancer is super common, like so common.
Mm-hmm.
And like probably like 1 in 10 women will have breast cancer, right? So it's like so common in our population. Knowing your history and knowing what your risk is helps us to determine what kind of screening you should undergo. And sometimes helps us to say, hey, you should probably really get like a mastectomy, to reduce your risk of breast cancer.
Mm,
So it's
okay.
just so important to know those things. So that's probably number one. Number two is any other kind of gynecologic issues. I usually say like as somebody in their 20s to 30s, it's very helpful to know if any women in the family have gone through premature menopause, meaning menopause before the age of 40
Mhm.
or, in their early 40s. Because especially now as women are having babies later on in life, you can really miss your window very easily. Especially if your family, if your mom, let's say, went through menopause at 41, you have a high risk of going through menopause around the same time. And so, you may want to consider that when you're thinking about like if you're going to, plan for a family, whether that be like, you know, freezing your eggs or freezing embryos or something like that early on if you have that risk. So that's another thing to think about. Things like fibroids, PCOS, endometriosis, we don't see as much of a one-to-one link in families. Now, I will say that I just generally see fibroids in Black women just very, very frequently. Um, if your mom has fibroids, yes, you do have a higher risk of having fibroids as well. But fibroids is such a heterogeneous issue. Like somebody like your mom could have had like one teeny tiny fibroid that didn't affect her at all, where you have like all these massive fibroids and you're needing surgery and things like that. So it's kind of like all over the place. So it's hard to know like what that link is and what that means to have like a family member with fibroids or even like endometriosis, things like that. Um, I think that PCOS is um, more commonly being diagnosed and detected these days, in young women. But the issue, and I wouldn't even really say it's an issue, but a lot of times what happens is if you're on like a birth control that can mask the symptoms of PCOS, because usually the symptoms tend to be irregular periods, and that's when most women will find out that they have PCOS. But if you're
Mm-hmm.
on some sort of hormone, that will definitely cause your periods just to be regular or not get them at all, or that in itself could cause your periods to be irregular. So PCOS is a tough one though, because it's like, it means a lot for fertility, it means a lot for general health and wellness,
Mm-hmm.
but it's hard to know like what to specifically do for women with PCOS, because um it can affect so many different things. And again, it's such a heterogeneous disorder that like, it may affect you one way and it affects somebody totally
Yeah.
differently.
Mm-hmm.
So it's hard to know exactly what the right thing to do for somebody who has PCOS is.
Mm-hmm.
And I'm sorry, I'm getting like a little off track with
No,
with the
it's okay.
question,
It's okay.
but yeah. So I mean, I think but yeah, okay. I would say the two most important: family history of cancer, family history of any like premature menopause. Those are things. And as we talked about before, just talking to your family members as a start of like various issues and symptoms that you're having when it relates to the female reproductive organs, your periods, your, moods, your this, your that. Like, it's very common that your mom probably went through the same things,
Yeah.
and they can help you through those. Although they were taught even worse than us not to talk about those things.
That's
So,
exactly. Yep.
you kind of have to pull things out of them, but, you
You
know,
really, really do, especially if you
yeah.
have like a mom who's like more like, reserved, and it's just like, oh my gosh, we
Mhm.
don't talk about those things,
Right,
like
right,
extremely
right.
to like the different extent. Like my mom is better now than she was when
Mhm.
I was younger at talking about it. Like she would just do like the basic conversation, and then she was like, okay, phew, that's over with. I'm not gonna talk about it again.
Yeah.
Now I'm thankfully more comfortable with asking her questions because, like I went through so many different things, and I'm like telling her about what's happening to me and what I'm experiencing and trying to ask her for advice. And now she's definitely more open, like, oh yeah, this happened
Mhm.
to me before. And I'm like, what? Like you could
Why
have
didn't you say
warned
something?
me.
Right.
Yes, you could have warned me because I'm just in the doctor's office. Like they be like, "Oh, does your family have a history of this?" Nope, nope. I'm just like just saying no to everything because I didn't know. So thank goodness, we're getting closer to being able to have these kind of conversations. Um, and now even my answers are changing because my grandmother actually did. She was diagnosed with breast cancer. Um, like two years ago now, and my aunt had it, so it's just like now my answers are going to change, but thank goodness they
Yeah.
were open enough to even let us know that that's what they were dealing with,
Right.
so we got to stop all these secrets in the family, like
I
when somebody's sick
know.
they don't want to
Yeah.
talk about it. Okay,
Yeah.
so you kind of already answered this one. So if my mom had fibroids, am I more likely to have them too?
Mhm.
And you said there's a small possibility. um, how much does family history impact fertility and miscarriage risk?
That's a tough one too, because again, it's very different. Now, the one thing that people don't talk about is that miscarriage is really common. Probably 1 in 4, 1 in 5 women will have at least one miscarriage in their lifetime. And so, the issue that women face is an issue with recurrent miscarriage, meaning that, they're having miscarriages over and over and over again. And for some women who have that issue happen, there's not really any link to anything. Like we don't find anything wrong necessarily. And for some women, they could have a genetic disorder that contributes to that. For some women, they can have an autoimmune disorder that causes that. And so it really it depends on like the underlying cause. Because if your mom had a lot of miscarriages, but there is not really a cost to it, then you're probably not more likely to have those that happen to you. But if your mom had, let's say, an autoimmune disorder, you have the same autoimmune disorder, then, you can be affected by the same issue with, issues with miscarriages and infertility issues and things like that. But by far and large, fertility in itself, miscarriages, pregnancy, um, is we think of it as a very kind of like individual journey, meaning that there's not a lot that you can tell me about your family that
Mhm.
is going to make me do anything different in your pregnancy or in your journey. So that is, I would say, can be a little less important. I will say though that, if your family member had a higher risk of preeclampsia, or if a family member had preeclampsia, then you are at slightly higher risk, and there's medications that we use to help to prevent preeclampsia, especially in,
Mhm.
African American women. But aside from that, there's not too much else, barring like an actual genetic disorder, that would change my management, throughout the pregnancy or throughout like looking into fertility. It's pretty kind of like standardized in like a stepwise procedure to evaluate somebody for infertility or for miscarriages, things like that. So yeah.
Got it. That makes total sense. Um, Last one in this section, and then I have one more before I let you go. So, are painful periods normal, or do we just convince ourselves to suffer through them?
So I would say that a painful period that's causing you to not be able to do your daily activities is not normal. So, it's normal to have some cramping during your period. It's normal to have some, uncomfortable symptoms, but you really should be able to still function. So if you can't function, then that is abnormal. And if you're like, and when I say function, I mean like still kind of be okay with your daily activities, not forcing yourself to do your daily activities because just you have to get them done. You
Okay.
know what I mean? So, um, now when I say, is it like when I say abnormal, there may not be necessarily an underlying cause
Mhm.
that is causing your period to be more painful than somebody else's. We may never find anything different that I can say, oh, this is why, Now, endometriosis is an underdiagnosed, medical issue for women,
Mhm.
mainly because in order to diagnose endometriosis, you have to do surgery. So you have to actually kind of like look in the pelvis to see if there's any endometriosis in the pelvis. And so, it's in the sense of like, you don't want to do surgery on everyone, you know what I mean?
Mhm.
Because
Yeah.
that's risky. That's why I would say that it's probably more so underdiagnosed. Um, but yeah, I mean, in somebody who's like literally crippled for 2 days, in the beginning of the period, that's not normal. That's not normal.
Got you. Okay, people need to hear that for sure. Because
Yeah.
people like, "Girl,
Yeah.
I got my period, so you ain't gonna see me for about 2 weeks."
Right.
And it's just like, "Ooh, girl,
Yeah.
we should
Yeah.
probably go see a doctor about that."
Yeah. Exactly.
Okay, so the next part that I wanted to talk to you about was gonna be, like, about, like, sex and, like,
Mhm.
the bladder. So, do women really hit their sexual peak in their 30s, or is that a myth?
Um, so I think it's a myth. I think everyone's different. And what happens is, as you get older, when you go through menopause, you essentially stop ovulating, right? And
Mhm,
so when you're ovulating is when you're most fertile. And that's usually when your like sex drive is the highest, when your vaginal stimulation is the highest, because naturally, like believe it or not, like we're made for birthing. Like that is
mhm,
just like what the whole point is.
yeah,
And so your body naturally like ramps up towards the time of ovulation, in order to, conceive.
mhm,
So it makes you want to have sex so you can conceive and make it easier to have sex so you can conceive. And so once you hit a point where you're not ovulating regularly, or when you're not ovulating at all, sometimes that can, decrease your sex drive, decrease your vaginal, lubrication, natural lubrication, things like
mhm,
that. And probably there's probably something to it where like between 30s and 40s, your body kind of like knows like, okay, these are like this is my last like few like really good fertile years. So let me like
Mhm.
ramp it up a little bit. Uh so yeah. But I do have many women like in their 50s and even like in their 60s who are like, yeah, I'm having the best sex of my life right now. Like,
Right.
this is
Come on,
amazing.
cougars.
So right, exactly. They're like, yeah, can't even I don't even have to worry about pregnancy. Look. So
Right, for sure, for
so
sure.
they're like very happy, in that. But I mean, I think it's something to it to why maybe like our, sexual drive and things like that is like tends to be a little high 30s, 40s, and then maybe even like early 40s.
Mhm.
So there's probably something to that. Yeah.
Okay, got that. How do hormones affect libido, and what
hmm
can women do if there's drops?
Yeah. So, so like I said, there's definitely the hormones definitely help to increase libido, which tends to be highest right around the time of ovulation.
Mhm.
Um, so after ovulation, your hormones basically, so you like your body's ramping up and then like the hormones, and then you ovulate and they peak like that, and then they boom drop down. So that's like how the menstrual cycle kind of works, or like the whole
Mhm.
cycle works. So when you're in that kind of like low phase, that's usually when your libido is not as high because like your hormones are like kind of in that lower phase. Not to
Mhm.
say that it won't be there. Some people just like have it all the time, but it's
Others
supposed
don't.
to be highest, right? But it's supposed to be highest around the time of ovulation, which just makes sense. So that being said, this is why so it's hard to know whether it's the change in hormones that affects libido or it's just kind of like the hormone levels like in themselves. But what I will say is so when people are on birth
Mhm.
control actually can affect libido and can decrease libido. And what birth control does is it uses all the hormones that we naturally have. So the hormones that we naturally have are kind of like down here. Birth control actually makes them up here.
Okay.
But what happens is there's a steady state. They don't change. They're the same every day.
Mhm.
And then when you stop taking when you get to the placebo pill, then they kind of like drop down and that causes you to have a period. Now, so
Mhm.
probably because your hormones aren't kind of like changing, that's probably why your libido is essentially like can decrease because you're not having like that fluctuation, that natural
Okay.
fluctuation of hormones. So it's
Mhm.
probably has something to do with the level and the fluctuation that affects libido. Again, it's hard to know for sure, but that's
Mhm.
probably, you know, along the lines of that.
Noted. It's so complicated.
It's very, very
It's like
complicated.
I wish it was like one shoe just fits all and then we just all
Yeah,
figure it out for each other, but
right.
it's like everybody's body is all so different.
It's very, very everyone's body's different. The way your hormones work for you is different.
Yeah.
The way that your own like sometimes if you have medical disorders affects your hormones in your body is different. Like it's just everyone's different.
Yeah. Seriously. Have you ever heard of the ashwagandha pills or like
hmm
the teas that you can make? Do
Yep.
you think that those can help like with or work for people like who are experiencing excuse me, low libidos?
So the thing with ashwagandha, so the data shows that ashwagandha actually it's kind of like a natural anti-stress met, like medication, if you will.
Uh-huh.
So what ashwagandha does is it decreases stress. And so if your libido is affected by like being under a lot of stress, being very busy, being tired all the time, can't sleep, all of those things, and you bring down those stress levels and then you're feeling better overall, then that in itself can affect libido.
Okay.
But yeah, so ashwagandha is actually like a stressfully like a yeah, it's like a natural antidepressant, if you will. But yeah, so that's what it's been shown, like data shows that like that's actually what it helps to do.
Okay. Got it. That makes sense. You actually answered the next question, which was literally about the stress and
Uh-huh.
like how that could change your sex drive. And then okay, so I had an older person who wanted to know the answer to this. So
Uh-huh.
I just have two more for you. So this one
Yeah.
says, why do women experience bladder leaks or urgency as they age? And what can be done about that?
So the bladder leaks is due to the muscles in the pelvic floor become weak. So the muscles and the tissue. So what happens is that's a natural process as you age. Women who have been pregnant before usually tend to see that a little earlier. But just because you've never been pregnant doesn't mean that you're not going to be affected by the it's like pelvic laxicity. So it's basically like the pelvic floor muscles have stretched out or they've become like older and weak, and so all the muscles like right underneath the bladder that hold it up don't hold it up as well. And so that laxity kind of causes those urinary symptoms. And so things like conservative things are like the Kegels. Sometimes actually like being overweight actually makes urinary incontinence symptoms worse. And so when women lose weight, they tend to be a little bit better. So things that actually like cause your bladder to fill up really quickly. So like caffeine, drink a lot of caffeine, alcohol, things like that. Those things are going to make your incontinence symptoms worse as well.
Oh, wow.
Um, yeah, I know, but it's
That's
what
deep.
what kind of life do you want to live? Do you want to live without your coffee and your chocolate and things like that? That's
Right. Like,
um,
sheesh.
yeah,
We're gonna have to make
yeah,
those
yeah.
decisions one day.
I
Oh,
know. Yeah,
no
exactly,
coffee,
exactly,
alcohol.
exactly. So, and then there are like surgeries and things like that that can help to correct it if it's like very bothersome,
Like, they
and
can
it's a real
tighten up
huge issue. Mm-hmm.
your
Yep.
pelvic floor and all of that?
Yep.
Okay.
Exactly. Exactly.
Wow, I never knew
So,
that. So is it
yeah,
true, like, if that when you're younger and you hold your pee a lot, like, does that affect you when you get older? Because
it
people will
doesn't.
say that
No.
when they be like,
Yeah,
"You
they
keep
will.
holding it, and then when you get older, you're not gonna be able to hold it no more."
Now, I will say though that if you frequently allow your bladder to fill up and don't empty it, what can happen is your bladder can overstretch. So then when your bladder, and this takes like years. Like it's not going to be like, oh, a couple of times I did that and like now my bladder's ruined. This is like years. But like if you continue to do that, then like let's say your bladder holds like half a liter, right? So then when your bladder hits half a liter, you're no longer gonna feel like you need to go to the bathroom. So now you're only going to feel like you need to go to the bathroom when it holds like a liter. And then if you keep doing it, you're only going to feel when it's like, overly distended. And then you're just going to start to leak because your bladder's so full that it can't even hold. But you can't feel it. So that's what can happen over time. But that's like really if you're like chronically like not
Yeah, like
emptying
going
your
to the
bladder
bathroom
all
when
the
you need
time.
to
Yeah.
go.
Yeah.
I could see how that could be a thing for me later on in life because living out here and being in this LA traffic, it's like I'm always like in that car, like, oh my God, I gotta go
Yeah.
to the bathroom so bad. So I gotta make sure because I'm like,
Yeah.
okay, wait, it went away for a second. Then all of a sudden it's like, you gotta go. But anyway,
Yeah. Right. Right. Right.
and then this was actually a social media
Hmm.
question that I had. This is the last one that I had on here. Why can a man get a vasectomy whenever he wants, but a woman can't get a hysterectomy on demand even when she knows she doesn't want children?
So, I will say that a vasectomy is like a office procedure. You just go into the office, cut the vas deferens and like can't have children. Hysterectomy in itself is a major procedure. So hysterectomy, meaning removal of the uterus, is associated with like a 6 to 8 week recovery time, associated with potential injury, potential risks of the actual surgery, depending on like if you had surgeries before. So hysterectomy is usually reserved for women who have issues with their menstruation, fibroids, like things like that. So we usually reserve that procedure since it is so invasive for those types of issues. Now, tubal ligation is a procedure that for the sterilization. The way that we do tubal sterilization is like a 2 week recovery time. And again, depends on, because you have to go under general anesthesia to get that done. So it
Mm-hmm.
depends on your medical history. Like if you're, a high risk for anesthesia, meaning that your heart may stop under anesthesia, then, I don't want to go in there and, cause that issue just
Yeah.
to tie your tubes. Whereas like a man goes into the office, they put some lidocaine, they cut it. It's like, soreness for a couple of
Lidocaine.
days. Yeah, yeah. Yep,
OMG.
exactly. Yep,
That's it?
yep. That's it. That's it. That is it.
What? I never knew that. That's
Yep,
insane. I got some lidocaine in my cabinet right
yep.
right now from something I had. What did I have? Like strep throat or something.
Okay, yeah, yep. Yep, they inject
Wow.
some lidocaine. They're still awake during the procedure, everything.
Snip,
So,
snip, and
it's a less riskier procedure, basically.
wow. Okay.
Yeah.
Well, that makes sense for sure.
hmm
Is there anything else that you wanted to clarify today for any women out there that might be listening?
Yeah, just to kind of like recap the point about dating your doctors.
Okay.
Find your doctor, find your person. Um, some tips and tricks. So my schedule is way backed up, right? So if you call right now as a new patient, what is it? We're in March. You'll probably get an appointment in August,
Mhm.
maybe. So that being said, because the new patients, there's like an office template. So my tip to getting in, especially if you have an issue, there's usually other people in the office that see patients for like their routine visits. So like we have nurse practitioners and things like that who see patients, and they'll do like your breast exam, pelvic exam, pap smear. But then once you're an established patient of the practice, you can go and you can see any of the doctors as an established patient, which typically gets you an appointment a lot sooner than
Mhm.
if you were to wait for the physician for a new patient appointment. So I always, that's just like a little tip trick that, I like to tell people, my friends
Mhm.
and my family.
Inside
Um,
scoop,
and
y'all.
yes. And then when you're making appointments, make the appointment for the issue that you want to address. Because again, so often I hear people say like no one was listening to me, things like that. And that's such a shame, and I want to increase the chances that you'll actually get your questions answered. And so if you go to the doctor and you said, I made this appointment specifically to talk about my fibroids, then guess what? That 15 minutes appointment, because that's really the time slot that we have,
Mhm.
is going to be dedicated to talking about your fibroids, right? So
Mhm.
getting your questions answered, things like that. So that's one of the tips I always tell patients too. It's like, when you schedule the appointment, say this is what you want out of the
Yeah.
appointment. Yeah.
Instead of just trying to make a general appointment all the time. Like,
Right.
"Oh, I just wanna
Right.
do just a routine checkup." I'm
Right.
no
Right.
like, I'm looking for a new doctor right now out here, and that is definitely something that I wanna, talk about, like, my fibroids,
Mhm.
because I haven't heard anything about them. My
Mhm.
doctor is not even the one who told me that I had fibroids. Like, I
Oh.
don't wanna get
Who
anybody in trouble, but, like,
Uh-huh.
so what happened was we were trying to conceive, like, we were trying to conceive, and
Mhm.
our first pregnancy, ended as an ectopic pregnancy.
Oh,
But
sorry to hear.
thank you. And so
Yeah.
I was just like I was like, "Okay," so I had to go back in my mind and figure out, "Okay, what was an ectopic pregnancy again?" Like, going back to health class, and I was like, "Well, I'm not to put all my business out there, but I'm pretty much an open book." I'm like, "I never had, like, the STDs that normally would lead to any burning or anything." So I'm just like, how could I have it? And so when I went to go get a screening, like an ultrasound, when they were still trying to figure out, like, where the baby was located, the ultrasound technician was just like, "Wow, like, I saw on your charts that you have, like, a really big fibroid on the side that you were, that the baby was coming out of, like, during, like, the luteal phase." And I was just like, "I read that chart, like, 20 times, I didn't see that." She was like, "No." I read your chart and I'm like,
Mm,
oh, okay. And so then that gave me more insight. And I was just like, I didn't
yeah.
even know I had fibroids. And so then when I took it to the information to the doctor, and I was just like, I I didn't know I had fibroids, but I do. And I was like, what can I do to like, can I get rid of them? Like, can I learn more about it? And he's just looking at me
Mhm.
like, most Black women have fibroids. Like, you just, either you get surgery or, you just kind of like just live with them. But if you get surgery, they can always come back. And he kind of like just bypassed the whole thing.
Yeah.
And I was just
Oh,
like, okay. And I was so confused. Like that was just, I was already like going through it,
yeah.
because that's such a hard part of life, like losing a
Hmm.
child or like any form of like miscarriage or anything within that fertility process can just be so strenuous. So shout out to everybody who has gone through it, who may be
Yeah.
going through it right now. Stay strong. You're not alone. But just keep asking questions too, because like that's when I started to go more of the holistic route, and that's when
Hmm.
I went vegan and learned more about
Hmm.
like Dr. Sabi, and I don't know if there's any real correlation, but I felt a lot better. Like my periods were different. My body felt different during my menstrual cycle. Like I didn't, for a while, I didn't even know when it was coming. Like I wasn't
Hmm. Hmm.
cramping or anything. And then a year later, we conceived our first child and didn't have any issues. So, but date your doctors for sure. And if they're not giving you the
Yeah.
answers that you want, y'all got dip.
See somebody
Like
else. Yeah.
yeah, we don't have to stay
Hmm.
around. We don't have to take that,
No.
especially if you are a woman of color,
Right.
because he was just like, "Oh yeah, most Black people have fibroids. You'll be okay. If I remove them, they'll grow back." Like it just like made me just go, and I'm like sitting there, I'm like I'm so confused. So
Hmm.
that's why we
See,
appreciate
that's an
doctors like
experience
you.
that's too common. That
Yes.
experience is too common. Yeah.
I hate that
I
for
wish
us.
yeah, I know. I know. I agree. So,
And I
I'm
was
sorry you had that experience.
Thank you, because it was so hard. Like we
Yeah.
live 3,000 miles away from our families even. So it's like but so much my mom can do over the phone,
Sure.
And so I'm
Yeah.
trying to be a big girl, go to the doctor by myself, and my husband, he doesn't know. He's just as
Mhm.
confused as
Mhm.
me. And then
Mhm.
some things, we actually got into some arguments too, like during the when we were preparing for our first child, that was like with the successful pregnancy, we hired a Black doula because I was just like, I need an advocate, to
Yeah.
go into that room and help me, just in case no one's listening. And it was like some things where he was just like trying not to make it such a big deal. And I was like, no. See, this is why I gotta have a doula, because this is a big deal. And
Yeah.
and but shout
Yeah.
out to my husband. I don't want to like he did a wonderful job during
Yeah.
everything. But there were some moments where I had to tell him, no, we're not gonna bypass this. We're not gonna make this seem like it's not that big of a deal, because that's what happens too much with Black
Right.
women, thinking that we're so strong, which we are, but how strong we gotta be.
Exactly. You shouldn't have to be. You shouldn't
Yes.
have to be stronger than everybody else, at least,
Yeah,
you know?
seriously. Exactly, exactly.
Yeah.
So, thank you so much
Of
for
course.
doing this episode. Like, I feel like it's going to help so many people, and hopefully we start having more conversations as women. Like,
Mhm.
is this normal? Is this not normal?
Mhm.
Let me just go ahead and make an appointment, even though it's not time for my yearly
Yeah.
appointment.
Yeah.
Make y'all our new
Yep,
besties.
absolutely. Yes, exactly.
If anybody wants to follow you or find out more about you, do you have like any information that you would like to plug at this time?
Yeah, I mean, so, I have an Instagram. My Instagram is very simple. It's just K_Willie, Willi. Um, and otherwise, I'm not a super social media,
Okay.
but, but yeah, you can find me at Cooper. That's where I see patients, so I'll be
Right.
around. Yeah,
Slide through the hospital.
exactly.
Perfect. Well, thank you so much again for joining us.
Thank you for having me. I had a great time.
Thank you. I hope that you guys enjoyed that wonderful conversation that we just had with Dr. Williams. Like I needed this episode. Like the childhood Felicia needed this episode so very badly, okay? And off camera I even told her, I was just like, girl, I was struggling when I had my first period because I was just so embarrassed to tell someone what I was experiencing. I was thinking, oh my gosh, like this, like people are going to think I'm nasty. People are going to think I'm disgusting, only because it's just like we just are so ashamed of our bodies from adolescence, just thinking, oh, this is not normal, or that's not normal, or this, it's just so confusing. So thank you again, Dr. Williams. When you are listening to this, I just need you to know all of us needed this episode, and you were just, the way that you answered and responded to the questions, and like nothing was weird to you. We need doctors like you. So thank you so much for being who you are. And I know this episode is airing in April, but happy Women's Month to all of you. I hope that you had a great March, and it was everything that you needed it to be. And we want to just keep encouraging everybody to study about your body and just learn more about what's normal, what's not normal, just so we can keep educating people and keep who we are going. Okay, we need to appreciate ourselves so that way others can appreciate us too. So again, make sure that you subscribe to this channel. I got to be in your business real quick, what y'all watching. Okay, right now I'm actually really into documentaries. So I've been like on my binge of different ones, just learning like what people are going through and like why y'all do that, and like even those type of documentary like series. So even one that social media got me into was Jay and Pamela. So I've been watching that on TLC. So what are y'all into right now? What are y'all watching? But like I said, subscribe. Make sure you check out the website. And listen, y'all just keep doing this adulthood thing, okay? Because we're all untangling it. So until next time, y'all, just keep untangling the realities of adulthood, because adulting is not always a straight line. Peace out.